Hi, I'm Dr. Craig Castanet of Backstrong Non-Surgical Rehab Clinic in Decatur, Georgia. I'm going to talk to you today about the question of how long should I go to a chiropractor after an auto accident. Typically, and this varies somewhat, of course, as medicine always does. On the short end, I would say if you've had an accident, it's worth getting evaluated. Sometimes you're not aware of pain, but it can be elicited during physical examination or when a doctor has you move full range of motion. So I would get checked out within a couple of days after an auto accident. There are also medical legal reasons to do this because you don't want to compromise a case that you may have against somebody who rear-ended you or struck you in their car, and you want any problems to be documented as soon as possible. Otherwise, they can be discounted if they arise, or you don't notice them or find out about them or realize them until several days to a week or more after an accident, as sometimes happens. Some patients that are involved in accidents are exercising good faith by not seeing a doctor. They may have some signs and symptoms that they're hoping will resolve with time, and in fact that can happen. But to be on the safe side, to document any problems that arise, whether you seek treatment once they're documented or not is another matter, but at least documenting them will protect your medical legal case if that happens to become, if symptoms and signs arise down the road and you decide then to seek treatment. In terms of treatment, I will often evaluate patients, and if, for example, they're not symptomatic or they're minimally symptomatic, I don't necessarily encourage them to do treatment. That's at their prerogative, but we've documented the problem, and I'll tell them that they should expect to improve over time, and if they don't, then they better come back in and initiate treatment if they need to. In terms of treatment, once treatment is initiated, on the short end, treatments are probably going to be 4 to 6 weeks of treatment. Typically, we'll start out 2 or 3 times a week and then reduce frequency depending on the rate of improvement. Other times, patients' treatment will last for as long as 12 weeks, sometimes even longer in some circumstances, but that's uncommon. The total number of treatments over the course of 4 to 6 weeks might be anywhere from 4 to 10 or 12 treatments, and over the course of, say, 12 weeks, total treatment number of treatments might be in the 20 range and sometimes beyond that. It's all dependent on the patient's response to treatment, how quickly they respond. Typically, younger people are going to improve quicker because there's less pre-existing degenerative changes that make them more vulnerable to traumatic injuries and more likely to have persisting or more enduring pain and problems that require more time to get recovered from. Sometimes there's also co-management with other physicians. So if I see somebody and they need referral to pain management, I'm happy to do that when it's indicated. I think sometimes that's done too frequently. The whole personal injury arena can be fraught with some behaviors that differ from conventional medical treatment because people are trying to protect medical legal interests. Sometimes patients are reflexively sent for MRI scans of the neck or back when I don't think it's indicated. Sometimes they're sent for co-management, for pain management when I don't think it's indicated. We want to treat people optimally, and we don't want to run up big medical bills. So if it doesn't serve a purpose, don't do it just as a matter of course. And so I don't. I treat people appropriate medically, whether it's in or outside a medical legal context. I treat them properly medically. But anyway, I hope that answers your question about how long chiropractic should last. Patients will often ask me how long I'm going to have to do treatment, and I'll tell them, this is not about me. This is not about how long I want to treat you. This is about, and I think this disabuses them of the idea that sometimes the doctors are involved in trying to create a legal case and protract treatment. I have no such preconceptions about treatment. And once I tell them, then they realize, okay, I'm not a player in this system that's sometimes gamed. I tell them, I'm here to treat you responsibly and appropriately, and I'm working with you. I'll advise you, I'll inform you, I'll tell you what your options are. I'm going to provide competent treatment. I'm going to try to get you well as best I can. I'm going to make referrals when it's indicated and in your best interest. but I'm not going to generate big bills with MRI scans and pain management that's unnecessary, because God knows those prices are very high, and if they're not necessary and you don't need them, and again, it's at your discretion. I'm here to inform you and tell you what I think is in your best interest, but you're in charge of what you want to do. I'm Dr. Craig Castanet in Decatur, Georgia. If I can help you, call me at 404-558-4015. I hope that answered your question. If you'd like to learn more, you can go to my website, backstrong.net, and from there, if you'd like, to my YouTube channel. If I can help, give me a call. Thanks very much. Bye-bye.